Hey everyone, it's Dr. Jen. It's What's Up Wednesday. Super excited to be with you today. It's been a crazy day already on Wednesday, so I'm actually so glad to have this half hour with you guys to hang out, relax, answer all the questions that have been sent to me about today's topic on What's Up Wednesday. And first of all, I'm going to say happy birthday to all the 1-year-olds out there and all the new mamas. This topic today is, I was this week seeing so many 1-year-olds or children that were turning 1 and can't believe the transformation from newborn through the 12 months to age 1, and what it's like, and how moms can't believe how different it is from having this new baby that you're holding 24/7, and now you have this 1-year-old who may be speaking and walking and doing all these different activities, and difference in how they're eating now. So there are just so many questions that parents have when it comes to their child when they're turning 1, especially at their 1-year-old visit. So I thought today maybe I would touch upon some of those common questions that parents want to ask their pediatrician, that they may feel that they don't have enough time with their pediatrician to get all their answers to all their questions. So I'm going to answer as many questions and those common questions that parents ask all the time at the first year visit, that they really want to know about keeping their child healthy, happy, safe, about development, peeing, pooping, pacifiers, car seats, you name it. There's so much to talk about when your child turns 1 at that office visit. And I know it's hard to get everything in, and that's one of the reasons why I do this What's Up Wednesday, to really answer your questions, all you moms out there and all you dads as well. So today on What's Up Wednesday, I'm Dr. Jen, and in case you don't know who I am a pediatrician. I've been in private practice in Manhattan for over 20 years now, and I care for kids from newborn all the way through young adulthood, and it's so great to see the changes and the transformations and how they then take ownership for their own health. And again, today we're going to be speaking specifically, answering questions about that 1-year-old visit, what to expect, and those questions that you may have that you may feel funny asking your pediatrician, or you just feel like you don't have enough time, because I know they're sometimes a rush to make sure the physical is complete and any blood work that may need to be done, and the child may be upset at the time or cranky, so you may have forgotten your list of questions. So here is your chance to ask me questions, and I'm going to give you answers. Also, to remind everyone, you can always go to my website, drjen.com, and you can find Pediatrician in Your Pocket. It's a total comprehensive video parenting guide manual, the only one of its kind, that really answers everything that you need to know about caring for your baby, and probably questions you didn't even know that maybe you should be asking or know about on your baby from newborn through toddlerhood. So that's called Pediatrician in Your Pocket. You can go onto my website and download that as well too. But today, specifically, let me start answering some of those questions that parents ask about their 1-year-old. And I'm going to start with eating, because eating is really a common question. So what happens at age 1? So the first thing parents often ask me about is, should I switch from formula? Or if I'm breastfeeding, do I wean, or can I wean and switch over, and what should I give them instead? So usually at age 1, if you have been giving formula, we do transition over to milk. And there's varying different milks, but cow whole milk, organic, if you can give organic, is great to give too. And it is really packed with vitamins, B vitamins. It has a lot of protein in it. It has healthy fats for the brain in it. So I actually do endorse and think it's a good idea to drink milk. However, you don't want your child, and they don't need to be drinking as much milk as they were doing formula, because the first year of life, the formula was really, or the breast milk is what they're getting as their main nutrient. So now when you're giving milk, that's really just sort of a supplement or a drink. I, as you know, anyone who knows Dr. Jen, is really big on water as a main option to drink. So kids who then are switching over from formula to milk may, as I said, may not be drinking that 32 ounces. In fact, I usually say about 16 or so, 2 to 3 cups a day maximum. After that, they may get constipated. It may make them too full. and then they won't want to eat other foods. So really, I wouldn't worry too much if they don't drink, and I don't actually really want them to be taking as much as they were if they were having formula. If you're breastfeeding, it's a different story because you don't really know exactly how much you're giving them when you're breastfeeding. But whole milk is, if you're going to give cow's milk, it would be whole milk that you want to give because, again, you want the fat for their growing brain is really important. Then there's other types of milk too. There's nut milks, there's almond, and there's cashew milks, there's coconut, there's soy. So soy is probably the most similar in composition for protein and calories that it is to cow's milk. You have to be careful though. With the nut milks, there's almond milk, there's cashew, and again, there's also coconut. You have to be look really closely at the ingredients, make sure there's not a lot of added sugar. And also, it's often watered down a lot, so you may not be getting the same calories, and then also not getting the same amount of protein. There's a much more protein in soy and in cow's milk. So make sure that you read the label. But again, as I'm saying, these are really supplement to the foods that we're going to be talking about that you're trying to get your child to eat as well, too. And that brings me to what should they be drinking in. So I like and I advise patients to get rid of the bottle starting at age 1. We really want them to be using straws, sippy cups, open cups too. It's totally fine. I get that it's messy, but that's how they learn. So you need to practice. And a straw is a great thing for them to use. You don't want them to just keep on using the bottle. What happens with the bottle is that they drink way more. Yes, it's true, but they're getting these extra calories that they often don't need because it's just a self-soothing. They like the rubber texture of the bottle, and they keep it in their mouth, and then it's filled with sugar, and it's not good for their teeth, and they drink too much. So I try to help parents wean off the bottle starting at age 1. Hopefully by the 1.5 that they're totally off. But you want to start giving milk as well as water, if you haven't already started, in a cup, a sippy cup, a straw cup at age 1. So they really, really are getting used to it. So besides what to drink, talk about food. So by the time your child has turned 1, the whole idea of introducing them to lots of foods, various types and textures is what we want. So you want them to have 3 meals a day, and then 1 to 2 snacks as well. And so they're kind of eating, it seems, right, like every couple of hours or so. And one of the biggest mistakes, or I would say misconceptions that parents have, is that their child's not getting enough. My child's not eating enough, and what usually it is, or that they're really picky. And usually what it is that parents are thinking about, what you eat as an adult or an older child might eat, but a portion for a child, a 1-year-old or a toddler, is way smaller than what you really would think. So a portion, instead of trying to do measuring out everything, I think it gets so crazy and that just makes parents really stressed out. But a portion for a toddler is about the size of your fist or their fist, which is really small, right? So they may eat half an egg. They may have a couple of slices of apple, or a couple of berries with it, a couple of whole grain crackers, or they might have some whole grain oats with it too, and that's it. Or they may have a small cup of yogurt with some berries in it, and you can add some, like even some wheat germ on top if you want some extra protein in it, or some fiber as well too. Or they may have a piece of toast with cheese on it, a whole grain toast with cheese on it, or avocado spread on it, or nut butter on it, and then just cut it into little pieces. But again, people think they should eat whole, 2 pieces of bread and sandwiches and another fruit. That's way too much for your child. So kind of go by their cues. Give them lots to choose from. And when I say lots to choose from, don't give them many options at a time, but throughout the day, you give them different foods. So they get exposed to new foods, and don't worry if they don't eat it. You don't ever have to push them. Don't make those threats that they have to clean their plate. That just makes more battles, and then makes them even pickier eaters. So the most important thing to do as a parent is to, when you have the toddler, is to have those foods out, let them see you eating them as a family. And if they don't want it, that's fine, and they can eat at their next meal, or they can have, if it's snack time, a healthy snack at that appropriate time as well too. So 3 meals and 2 snacks. You can give milk 2 to 3 cups a day. and everything else should be water. I like to give fruit, and I'm really not big at all about giving fruit juice, even diluting it down. It ends up being that they just always then crave sweetness. And we really are trying to give them, as I said, lots of different savory and sweet and different textures, and there's lots of spices you can use. Really, the key is to try to give as many healthy foods as possible and try to stay away as much as possible from processed or foods that have extra added sugar to them. And that's really like the issue that we're seeing. I'm more worried about the obesity issues and being overweight than the kids that are really picky, because if you're a healthy eater and your family's healthy, they usually do get better over time. I've been doing this for decades, and I'm telling you that's the case. So really offer, but again, to remember that the size of their fist is really the amount that they should have on their plate and no more. So moving on to foods. The other question parents ask me, well, what about peanuts and those allergic foods? So the research now shows actually you should have already given them. By 6 months of age, we really want to give peanut products and other highly allergic foods as well too. Unless your doctor or there's a family history who says not to, we want to introduce peanuts early on. It's really important. So how do you do that? So there's, first of all, my patients here in New York, and you can get it online, but there's a snack called Bomba, and they're these puffs that are peanut, have peanut in them, and they taste great. And I have not met yet a kid that has not liked them. But that's a great way to introduce peanut butter. You can also take a little bit of peanut butter and mix it into, say, oatmeal or into other foods that they're eating. And 2 to 3 times a week at least. They say about 2 to 3 teaspoons a week. Again, the more you do it, the more frequently, a little bit each time, will then can help, now we've learned, to decrease the onset of peanut allergies. So you don't want to wait. You want to start that early. If they're older, like, you can put a little bit of peanut butter or different nut butters on bananas and slice it up into little pieces. So just use your imagination, all different ways. But yes, you do want to do peanuts and tree nuts early on, as well as the other allergic foods such as fish and shellfish. Eggs too is great. Eggs, I think, are really great and healthy for kids to eat. They also can be high in omega-3, which is a fatty acid that is important for brain development for young kids too as well. So that's really important. Another question parents ask me, because we talk about poop a lot, so as they're starting to eat foods, especially at age 1, their poop is starting to get a little bit harder, and they may be a bit more constipated. So water is so important. Drink a lot of water. You can give them actually some prune juice or diluted prune juice if you want. Dried fruit you can do too if you cut it up small. And also just fruits and vegetables. Just be careful that there's nothing that they can choke on. So you want to make sure that they're soft. They're not really, really hard and too crunchy, like carrots can get, to make sure they're cut in little pieces so that they don't choke on them. But fiber is really important too. So you want water and you want fiber to help combat that constipation. And how much fiber do they need? And again, like, the amounts always get parents crazy, right? Because you're trying to figure out how much exactly. So if you're eating a healthy diet, they're eating lots of fruits and vegetables, they kind of stay away from processed foods, and drinking a lot of water, they'll probably be doing okay. But my sort of fiber trick is if you take their age and you add 5 to 10 grams, then that's how much they need. So for a 1-year-old, they would need between 6 to 11 grams a day, and you can split that up throughout the day. So if they're having some fruits and vegetables or some whole grains during each meal or snack, then they probably will be getting enough fiber for them to have nice, soft stools as well. Probiotics, I get asked a lot about that too, and I'm very pro probiotics. That can also help with digestion as well too. It helps with your immune system, and supporting it, as well as digestion too. So probiotics you can give as young children, you can give infants, but definitely 1-year-olds, and it comes in different ways. There's certainly probiotics in foods like yogurts, but really to have the effect on the body to support and help the immune system, usually in a supplemental form, because it needs to get all the way down into your intestine, past the harsh acids of the stomach. So I like Lactobacillus GG, which is Culturelle, but I'm actually going to say here, and this has nothing to do with them, I do partner with Culturelle. And I like it because it's easy for kids to take. There's a lot of science and research on lactobacillus GG for immune support as well as digestive health for kids. It comes in powder form that you can mix it in, and it comes in also a chewable that young kids can take as well too. But you can also get probiotics other ways as well too. Again, other foods that parents often ask me about is actually vitamins is really what they ask me about. So if you're eating a healthy diet, for the most part they don't really need to take any extra vitamins. I would make sure they're getting enough omega-3s, and so that would be salmon and beans. Omega enriched eggs is a great way too, but if not, you can take a omega supplement for kids as well too. Iron is really important too. So if they're eating red meat, and again, if you have it in moderation, small amounts, so red meat is a great way to get iron that kids need, but you can also get it in other fruits and vegetables. Dark green leafy vegetables is a great way to get it. If you take it with vitamin C, then the iron also will be absorbed more too. Your pediatrician probably will check within the first year of life to check for anemia and iron deficiency and see if they need more iron-enriched foods, or if they also may need to take an iron supplement. And it may be because their diet is poor, but it could also be because they're growing really quickly too. It's amazing. We're talking about 1-year-olds, and they have actually tripled their birth weight. So that's really a lot, right? And they've grown quite a bit. So they do need really to nourish their bodies. And other important questions, let's sort of moving away from food, because I know I've been talking a lot about food and nutrition, but development. So as I said, they triple their weight, but what else are 1-year-olds usually doing? So usually by then, they can say mama and dada, and they usually say it specifically to mommy and daddy, and they may know other people who in the family or close caregivers' names or have names for them. And they may say one or two other words as well too. What's most important at that age is not the amount of words, but understanding. So usually by 1, they're definitely understanding common words. And if you ask them something like clap your hands or wave bye-bye, they should be able to comprehend and do them. Usually if you give them a command and a gesture like come here, they'll be able to do that as well too, and that's really important. Another common question about development I get is, how come my child isn't walking? I thought everyone walks by age 1, and that's definitely not the case. So usually by 1, they should be able to pull themselves up to standing, kind of what we call cruise, walk around like either holding your fingers or holding onto a push toy or around a table. They definitely should be doing that. They may stand and let go for a second. Some kids may be able to take a step or two, and that's probably very common. And then there are some kids that definitely walk, but as many of you may know or may not know, many kids don't walk until about 18 months. So don't be concerned if they're meeting all their milestones, but they're not walking as of yet. It doesn't mean that there's going to be an issue, but of course, always bring it up to your pediatrician if you have any developmental questions or concerns at all. It's better to be on top of it, whether it's motor skills, gross motor skills, fine motor skills, language, or any type of thing. If you're concerned or think there's delays or anything seems abnormal, please bring it up to your pediatrician as soon as possible. There are developmental testings that they can do, or even screenings. Early intervention is a program that can help kids who may have significant delays early on. So make sure you take advantage of that, and always feel free to speak up and ask your pediatrician if you have questions regarding their development. Dentist and teeth is another important topic that comes up, and how many teeth. And it's so variable. Teeth usually start to come in at 6 months of age, but some babies are born with teeth, like my nephew. I see my sister is watching, and that's okay too. Some babies, though, don't even start to get their first teeth until they're age 1, and that's okay too. What we recommend now is that they should go to the dentist just to see what's going on, to take a look in the mouth, make sure everything is good. If they can brush their teeth, when you are brushing your baby's teeth, you should use a toothpaste with fluoride in it. It could be a child's toothpaste, but it should have fluoride in it, and you really just want to use the smallest like rice grain of toothpaste until they're able to spit it out. But you do want the fluoride to get in their mouth, on their teeth, and they may swallow a little bit, and that's okay as well too. But they should go to a pediatric dentist if it's possible in your area. If not, they should see a dentist that is used to children, but at least have their pediatrician also do a good oral evaluation of their mouth too at one. And that's, again, talking about not having the bottle anymore, specifically definitely not juice in the bottle or sleeping with a bottle, because then again there's even more decay in their mouth. Which brings me to pacifiers. So many parents ask me about pacifier use, and it's one of those things that, you know, I always tell parents, like, you shouldn't force it, but babies do have a normal reflex at the beginning of birth to suck, and they like to suck, and that usually starts to go away around 3-4 months of age. And I actually am big on, if they don't need the pacifier, then by 6 months of age to get rid of it. Because if you don't, it just gets more and more difficult to get rid of it, because the kids get more stronger, they're strong-willed, you don't want to hear them crying. But it's really like a personal preference. Certainly it can have an issue and an impact on the development of the teeth, making them stick out or protrude more, or the development of the mouth, and gums as well too. And so the dentist doesn't like it. It can also interfere with speech as well. So at the beginning, you should use a pacifier if the baby is cranky or it's helping to self-soothe them. Once they fall asleep, I think it's a good idea to take it out. This way they don't get used to it. Every time it falls out, you have to go put it back in. And that's okay, but if that is what you choose to do, probably that period between like 3 months to 9 months old, to 9 months of age, when they can't do it themselves, you're going to be back and forth a lot putting that pacifier back in. So if they get used to sleeping without it, it does make it easier. But I have to say, the American Academy of Pediatrics, they do recommend pacifiers for the first year of life. It has been shown to be associated with decreased SIDS. So certainly if you use it, I do though then like to get rid of it by age 1. To me, almost anything, it's easier to get rid of it just doing it cold turkey. I know a lot of parents can't do that, but my advice is it's easiest that way. It usually takes a couple of days, and then they get used to not having it. They may cry, they may get upset, but if you take away the pacifier, you can give something else, like a lovey or a blankie, a stuffed animal, or something else, a burp cloth that they've had since they were little, something so that they can hold instead. And they will get used to it. It's not unusual, but that's really up to you. Sometimes people have pacifiers later. They wait till they're age 2. They have pacifier parties where they send them off up in balloons. It's all different ways. It's really what's best for you. But honestly, there is no like psychological damage or anything if you take the pacifier away from them or their blankie away from them. They will get over it. People always cite these studies about their brain development, and you're doing such damage and stress to the child when you take away something like their pacifier, or you let them cry a little bit. But if you're coming from a loving family and they have a support system and that you're there for them other times of the day, it's okay if your child cries a little bit. It's all a learning process too. So don't be concerned, if your baby does cry or get upset. I can just tell you that I remember when my youngest, my daughter, turned 1. She probably won't like that I'm giving you guys this story, but when she did turn 1, and we decided not to use the bottle anymore, and I put the milk in the sippy cup, she just pretty much threw it at me for like 3 days straight, and she just didn't drink it. And once she saw that there really was no bottle, then she was fine with it. To this day, obviously, she doesn't remember that, and we didn't really have so much video back then, so I don't really have her throwing the bottles across the room, the sippy cups across the room, but you know what? It's fine. And she got over it, and now, she has milk in her cereal. She can drink it from a cup. So please, don't get too concerned. If you give hugs and kisses to your child, taking something away like a pacifier or a bottle, they're going to be okay, and really you don't have to worry about it. But again, each parent can do it on their own time. There's no scientific evidence that it has to be done at a specific date or a time. So moving on a little bit more about car seats. That's a big thing that parents talk about too, because all they want to do is turn that car seat around and face forward. And yes, a long time ago when I had my kids, It used to be at age 1 we'd turn the car seats around, and they had a big enough weight and you were able to turn them around. But now we know from so much more research that facing backwards is the safest way in the car and for as long as possible. So the American Academy of Pediatrics says to at least age 2. I would prefer longer, but at least age 2. And so if you have a infant carrier, you need to check the weight that your baby can stay on it facing backwards. And if your child has outgrown it, you can buy a car seat that still faces backwards with a harness or restraint system that your baby can be facing backwards and still be comfortable. It's okay for their legs to be bent. They can kind of, relax. You can listen to music, you can still talk to them. Again, this is what they grow up with and they get used to it. I know when I was younger, we hardly even used seatbelts, but now it's just automatic. So I think younger kids now are getting more and more used to facing backwards, and it's the safest way. And if, God forbid, there's an accident, it's the safest for your child to be buckled in a car seat properly, in the right position and facing backwards. So I recommend that to continue to stay in that as long as possible, that you can do that in your car. And then just maybe a little bit about safety at age 1. So now your child is a toddler and they're moving around. And they're also falling a lot because, as I said, they're still just learning how to walk. So you want to make sure that you have like non-skid sort of rugs or carpets, that if you have a rug that you can sort of tack it down or even just remove it. You want to make sure that edges of tables, that you can put padding around them, because we often see lots of bumps and lacerations on the face, and parents freak out because it's on the face, but that's usually where it happens above the eye or the chin from falling and hitting themselves on the table. So you want to make sure that there's also nothing that they can grab and pull down off of tables too. So I say get down on your hands and knees to their eye level and move all those things away that they can hurt themselves with. Do a nightly couch check. So things, because kids at this age still like to put a lot of things in their mouth, and they may have older siblings, so little, I call Barbie shoes, or pens, barrettes, coins, anything that they can swallow or choke on. So do the couch check every night. Make sure that you vacuum. Decals are really important too. Like if you have big windows or doors, you can put decals on them so they don't walk and bump their head like right into it. That's a common issue as well. 2, safety for products, and especially for cleaning products, make sure they're high where children can't reach. Always talking about detergent pods now. They look like candy, so maybe definitely put them up high where they can't reach. And I always say, like, have a drawer and a cabinet in your kitchen that a kid can play with, that there's all things that while you're in there that it's okay. Plastics, bowls and wooden bowls and spoons, and plastic containers that they can play with that don't have obviously toxic substances, but they can be in, and because they like to open and shut things, which maybe I'm going to lead right into toys and development too. So kids like to play, and right, you buy all these expensive toys that you probably don't need, and they like to play with the boxes, and they like to put them on their heads and take them off, and they like to then play with the stuffing or the plastic that comes in it, and pop the bubbles and stuff as well too. So don't make yourself crazy with zillions and zillions of different toys. You may want to have a few and rotate them, but things for 1-year-olds, push toys are great. Cause and effect toys, they may start with really big chunky puzzles that they may like to start to do as well too. Animals, farms, soon they'll like to do a lot of imitation, so like a kitchen that they'll be able to play with, or even just balls of different sizes and shapes that they can throw, or either start to do back and forth with an adult, either rolling them back and forth or playing with them. There's also like activity centers where there's push things and things make light up, where they can walk around and either put balls in. So there's so many different things. I actually think the most important thing is not to overwhelm them. You don't need to do so many things. Put out a few, and maybe the next week rotate them so everything looks new and exciting. And the most important thing I'm going to leave you with is reading. You can never read enough to your child. So I know they may not have long attention spans, but start reading a book. They may come over and want to sit on your lap. If you have books that are like hardcover books that have like flaps in them that they can open and close, that have different textures, that they may have animals that make different sound, things that they can point to, common objects, and do the same books over and over. And so they can anticipate what you're going to say, and they're going to like it too. They'll learn words and can fill in the blank and point to things too. So I hope this was helpful. I probably can go on and do a part 2, 3, 4 on toddlers and 1-year-olds and questions, but I hope that some of your main questions about 1-year-old were answered. If you have more, I'm getting some great questions here. I will answer them for you, so you can either drop me a line underneath on Facebook Live, on Instagram, even on Twitter, or go to drjen.com on my website. And if I keep getting similar questions, I will do, of course, another Facebook Live on that topic. I hope this was helpful and that you get a lot out of your 1-year-old's visit with your pediatrician as well, too. I'm Dr. Jen, and for more information, and if you want my whole complete video guide on caring for your child from newborn through toddlerhood, you can go to drjen.com. It's called Pediatrician in Your Pocket. And I hope to see you all next week on What's Up Wednesday with me, Dr. Jen. Have a great day.